Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Falls send a lot of people to the ER. In fact, more older Americans die from falls than from breast or prostate cancer. This is the People's Pharmacy with Terry and Joe Graydon.
The number of deaths from falls in the U.S. has been increasing dramatically in recent decades. That's not true of other developed countries. What makes us so vulnerable? One of the novel symptoms that people reported was a loss of the ability to smell. Now research indicates that this problem can last for years. The study, called RECOVER, included 1,393 people who said they had trouble detecting odors. In addition, 1,563 were included who did not report that problem. Nearly all of the volunteers had a documented COVID-19 infection. The researchers tested participants' ability to smell. 80% of those reporting olfactory difficulties had tests confirming the problem. Somewhat surprisingly, 66% of those who did not report trouble smelling also had some abnormalities in their sense of smell. Of those, 8% were severely impaired. Not being able to smell is bad enough. The investigators also report a link between an impaired sense of smell and cognitive difficulties or brain fog. Scientists suggest that these deficits could have a profound impact on people's well-being.
The FDA first approved the anticoagulant heparin in 1939. It was originally used to prevent blood clots. A new study of COVID patients demonstrates that heparin can prevent severe complications from SARS-CoV-2. 238 patients with COVID were assigned to receive inhaled heparin. Another 215 received standard of care, and 25 got placebo. In-hospital death was far higher in the control group. Heparin is not just an anticoagulant. It also has antiviral and anti-inflammatory activity. Administering it in inhaled form can prevent lung injury and blood clots in the lungs. The researchers suspect that heparin could be beneficial against other serious lung infections, such as pneumonia or influenza.
It may sometimes seem that people who have heart attacks or strokes are struck down out of the blue. A new study suggests that instead, nearly everyone who experiences a cardiovascular event had at least one suboptimal risk factor beforehand. The research included more than 9 million adults in Korea. A routine screening in 2009 recorded blood pressure, cholesterol, blood glucose, and smoking history. The scientists also checked prescription records for medicines used to treat these problems. When researchers checked participants' health records after 13 years, they were able to see who had developed cardiovascular complications and who had not. They also studied nearly 7,000 American adults participating in the multi-ethnic study of atherosclerosis. These middle-aged to older individuals did not have heart disease when the study began. They too had their blood sugar, blood pressure, and cholesterol measured, and they reported if they were smokers. Nearly 18 years later, investigators determined who suffered heart attacks, strokes, heart failure, or cardiovascular death. In both Korea and America, 96% of those who experienced complications had blood pressure above 120 in the initial screening. Even though this wasn't technically hypertension, it was considered non-optimal. High cholesterol and high blood sugar were also common. Most
Please
people
subscribe.
had
You will
multiple
see
risk
lots of
factors.
informative videos
The
about
CDC
pharmacy
is
and
reporting an
pharmacy law.
alarming rise in drug-resistant
Subscribe now.
DMCRE. This group of germs has surged in recent years and can cause pneumonia, urinary tract infections, sepsis, and wound infections. These bacteria are highly resistant to existing antibiotics. That makes treatment very challenging. Experts recommend testing and preventive strategies such as adherence to disposable gowns, gloves, and masks when interacting with patients.
People at high risk for cardiovascular disease are sometimes encouraged to take aspirin as a preventive. A new study investigated whether the Prevent risk calculator can determine who might benefit from aspirin for prevention. The vast majority of those who reported taking aspirin to prevent heart attacks did not qualify based on the Prevent risk calculator. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. Today, our lines are open for your calls and questions. Have you had a bad fall while taking a medicine that made you dizzy or drowsy? We want to hear your story. Our lines are open at 888-472-3366.
Today's topic is about avoiding falls and becoming aware of which drugs might increase the risk of falls.
To start off, we're talking with Dr. Thomas Farley, Professor of Community Health at Tulane University. Dr. Farley wrote an alarming analysis in JAMA Health Forum in August titled Risky Prescribing and the Epidemic of Deaths from Falls.
Welcome to the People's Pharmacy, Dr. Thomas Farley.
Thank you. It's good to be here.
Dr. Farley, we saw your opinion piece in JAMA Health Forum a little while ago, and it really got our attention. It was titled Risky Prescribing and the Epidemic of Deaths from Falls.
It's a very important.
Tell us a little bit about what prompted this really important article.
I'm an epidemiologist and a doctor who works in public health, and was writing a textbook for public health students on the roughly 30 leading causes of death in America. And one of those is falls in older adults. And as part of my routine research for the textbook, I looked at trends in falls. And I was shocked to see that over roughly the past 30 years, that the mortality rate from falls in the United States has roughly tripled. So we now have about 45,000 people dying per year from falls over the age of 65. And I found that increase had not been seen in other countries around the world. The U.S. is an outlier in this. So I said, this is an important problem that people need to understand what's behind it and also to take seriously.
And Dr. Farley, we want to ask you what the reasons might be. What you wrote was, in 2023, more than 41,000 individuals older than 65 years died from falls. Among older adults, the number of deaths from falls is more than from breast or prostate cancer and is more than from car crashes, drug overdoses, and all other unintentional injuries combined. What the heck is going on?
That was exactly the question I had. What the heck is going on? Why are we seeing this tripling of falls to where now this is really an important cause of death in America today? You know, older adults have always fallen. They've always been at risk for the falls. But why would we see this increase? And so the next thing I did was to say, well, what are the things that put people at greater risk for having a serious, fatal fall? And there are things like having a physical disability, having vision problems, maybe having cognitive problems like early dementia, living alone, having a cluttered household, using alcohol. But none of those things, we have any reason to think that they would have tripled in the past 30 years. On the other hand, there have been big changes in prescribing of prescription drugs to older adults. So that's what led me to really look into what has happened with prescription drugs in the past 30 years.
So let's drill down on the medications, if you don't mind. You know, there are some drugs that are highly sedating. You know, the anti-anxiety agents, what we call the psychotropics, the drugs for schizophrenia, for example, or
if you can hear the video, just let me know, sum up or anything.
Your depression. But there are lots of other medications that can make people feel dizzy. And I think that a lot of doctors just sort of pass over that pretty quickly without really asking people, is this medicine making you feel dizzy? And I'm particularly thinking about high blood pressure. because the guidelines now say 120 over 80. Doctor, you've got to get everybody. I don't care how old they are. Everybody needs to be under 120 over 80. And yet, that may take 3, 4, or 5 different blood pressure medications to achieve that goal. And that can lead to something called orthostatic hypotension and dizziness. So if you could drill down a little deeper on the blood pressure problem.
If I could first, I'll talk about the drugs that affect the brain in other ways that you mentioned. Really, any drug that makes you drowsy or clumsy, sedating, is going to increase your risk of falls. Those are things the drugs that I worry about the most. But then, as you say, there are other drugs that affect your heart and cardiovascular system, which may cause people to just have less blood flow to the brain over a very short period of time, and they have a fall from that. As I look at the data, I have to say I'm more concerned about the first category, the central nervous system active drugs, than I am about the blood pressure drugs. Blood pressure clearly is a serious problem. It increases your risk of heart disease and stroke and kidney failure. People with hypertension need to be on medications, but there are safer high blood pressure drugs and there are less safe high blood pressure drugs. And so it is fair for people who are older adults who are on a high blood pressure medication to talk to their doctor, say, is this one of those high blood pressure meds that's going to increase my risk of falls? Is this one that is safer?
Now, Dr. Farley, in the article in JAMA Health Forum, you do talk about categories of medications that might make people drowsy or woozy. Benzodiazepines, for example. And when we write about benzodiazepines, which we do from time to time, we usually say this category of drugs is generally considered inappropriate for older adults. Are doctors paying attention, or are they still prescribing benzos for older people?
They're still prescribing benzos for older people. From what I could find, there's not as enough research on this as I would like to see. But I found one study that looked at people over the age of 85 who were seen in an outpatient setting. 20% of them were given prescriptions for benzos. That's absolutely a very high risk drug for them, and that's not appropriate. Overall, there was a study done, published in JAMA Internal Medicine, that showed more than 90% of older adults are taking prescription drugs, and 45% are taking prescription drugs that are considered to be potentially inappropriate. So there's an awful lot of prescribing going on out there on drugs that are potentially quite risky. Benzos being one of them that make me worry a lot, but others as well.
We're talking about diazepam, Valium, alprazolam, Xanax. These are drugs that a lot of people take for anxiety. But there are also problems for some people with antidepressants that can make them feel dizzy as well. And millions of people are taking antidepressants on a regular basis. I'm also wondering about antihistamines because, people, if they have stuffy nose or allergies, are likely to take over-the-counter drugs. And some of them, like diphenhydramine, Benadryl, can make people very woozy. And now all the PM pain meds, the Aleve PM and the Advil PM and the Tylenol PM, they all contain diphenhydramine. And for some people, they may have a little wooziness if they have to get up in the middle of the night.
Yeah, so definitely, I think of antihistamines in two categories. There's kind of the older ones, as you mentioned, diphenhydramine, that absolutely make people, that are sedating and make people clumsy, so they could increase the risk of falls. The newer ones are probably less likely to do that. And I don't have data out there as to which ones are prescribed more these days or whether there's an increase in one category or the other. But that's absolutely something that I would be concerned about.
I have a letter that we received from one of our readers. She says, a few years ago, my cardiologist put me on spironolactone to lower my blood pressure from 140 over 80. Shortly thereafter, I got up from bed for the bathroom. I blacked out in the bathroom, fell, and fractured 2 vertebrae. I was given a walker and kept on spironolactone. Later, I was using the walker to get to the bathroom in the middle of the night. I blacked out again, fell onto the walker, and cut both knees. That resulted in a 3-week stay in a rehab facility. My cardiologist never mentioned that spironolactone might make me faint or fall. I'm no longer on any blood pressure medication, but due to the fractures, I am 4 inches shorter and my life has been changed forever. I think we sometimes forget that, dizziness sounds like such a mild side effect, but it can have devastating consequences.
Yeah, for women in particular, a fall, even a small fall, can lead to a hip fracture. And hip fractures absolutely can be fatal in older adults. And so, there definitely are some antihypertensives that are going to increase the risk of falls more than others. And so, again, I'm a big believer that we should treat people with hypertension. I don't want anybody to get that impression.
Right.
But I do think that older adults need to be having a serious conversation with their physician about, are they on an antihypertensive that is going to be safe from a falls perspective?
We just have a minute left, but it seems like very rarely do health professionals, especially family practice doctors or internists, actually check people for their potential for dizziness. It might happen, at physical therapy. It might happen at health coaches. But shouldn't doctors be checking for dizziness every time an older person comes in who's taking many medications?
They should be assessing the risk of falls more broadly, and dizziness would be part of that. But also, the other things: are they particularly physically frail? Do they have vision problems? And there's a falls risk checklist that they can use, and they ought to be far more careful with patients that are at risk of falls than those that have a lower risk of falls. I think more generally, this data says to me that not just individual doctors, but health systems as a group ought to be looking at this in the same way that they looked at opioids in the past and say, we need to be pulling data on our providers and see who's prescribing these fall risk increasing drugs, like FRIDs, a lot. And if so, have some conversations with them about how to get patients onto either drugs that are safer or to see whether they need to be on the drugs at all.
Dr. Thomas Farley, thank you very much for talking with us on the People's Pharmacy today.
Thanks for having me.
You've been listening to epidemiologist and health educator Dr. Thomas Farley of Tulane University. You can find a link to his paper on our website.
Our phone lines are open for your stories, comments, and questions. That number, 888-472-3366.
You could also put a comment on Facebook or at People's Pharmacy.
Again, that number, 888-472-3366. We invite your questions about medications that might increase the risk for falls.
Again, that phone number for you, 888-472-3366.
You can leave your comment here or your question here, and I will answer it for you. It's very
You're listening to
important.
the People's Pharmacy with Joe and Terry Graydon.
Pura Vida means that happiness guides our journeys, that we live in harmony with nature, and everyone is welcome to experience this energy. That's Pura Vida. Join the vibe at visitcostarica.com.
You're a podcast listener, and this is a podcast ad heard only in Canada. Reach great Canadian listeners like yourself with podcast advertising from Libsyn Ads. Choose from hundreds of top podcasts offering host endorsements, or run a pre-produced ad like this one across thousands of shows to reach your target audience with Libsyn Ads. Email Bob at Libsyn.com to learn more. That's BOB@LIBSYN.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared, drug-free treatment for nasal congestion and runny nose. A sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Today we're talking about FRIDs, F-R-I-D. Is that acronym new to you? It was for us. It means fall risk increasing drugs.
We invite you to share your story about a medicine that might have made you feel, woozy or unsteady. Our number, 888-472-3366. Again, if you'd like to join our conversation, we are live in the studio. 888-472-3366.
And Joe, we have a comment from Jeannie. And she says, I'm 80 plus years old, and at this point I'm taking no prescription drugs because every one of them has side effects. I have high blood pressure, 142/70, and my doctor wanted me to take losartan. After reading the side effects, I decided the answer would be no, because it can cause dizziness. It can also lower your heart rate, and mine's already low. I average 40 beats a minute, and when I'm asleep, sometimes it's 30 beats a minute. Taking losartan means I could fall and maybe break a hip. Some seniors who break their hips have died within a year because of the stress on their bodies. Why would I want to trade one problem for another problem? Very good point. We do need to point out, you have to do the balancing act, right?
You do have to do the balancing act. It is critical to keep your blood pressure under control. We don't want anybody allowing blood pressure to skyrocket. But sometimes trying to get everybody down to below 120/80 can lead to dizziness, especially something called orthostatic hypotension. It's when you stand up suddenly and then all of a sudden you get dizzy and then you may fall. And that's because of the blood pressure medication. So as Dr. Farley said, you want to make sure you talk to your doctor about drugs that don't make you feel dizzy. Again, our phone lines are open. 888-472-3366 is the number to call if you have a story to share.
And we go to Arlington, Texas to talk to Ann. Ann, your question, please.
Hi, this is Ann. I was wondering if I only take Synthroid in the morning before I eat, but I'm dizzy right when I get up, and then I'm kind of dizzy until I eat more during the day. How do I figure out what's making me dizzy?
Good question, Ann.
Well, first, are you taking any other medications besides Synthroid, which is a thyroid medication, right, Ann?
Yes. Just later in the day, I take hydroxychloroquine and some supplements, calcium and that kind of thing.
Usually we don't think of supplements as causing dizziness. And generally speaking, Anne, I wouldn't expect Synthroid to cause much dizziness either. This sounds like you may need to have a more in-depth conversation with your doctor.
I'd have to look up hydroxychloroquine, Terry.
Yes.
Because, it is a drug that is prescribed. It's an old-fashioned medication. It's sometimes used for arthritis symptoms, for example, or other autoimmune conditions. And so it's not clear to me if that could be a contributor, but you definitely want to be very careful when you get up in the morning, and so that you don't, on your way to the bathroom, for example, have a fall. So that's a critical issue to bring up to your doctor whenever you get a chance, okay? Thank you so much for your call. Bye-bye. Terry, it looks like you've got Bert in Clearwater, Florida.
Let's go to Bert and find out what's on his mind.
Hi, Bert.
Hey, Bert.
You there?
Hello, yes.
Go ahead, please.
I'm here.
What's your question?
I was just calling in to say that with respect to dizziness, I've had some problems with taking Flomax and drugs for similar kind of problem, and that I find that, like when I'm sitting on a couch or something like that, I'll get up and I'll be dizzy and have to put a hand out and steady myself for a few seconds or whatever until that goes away, and then it'll go away, and then I go ahead without what I'm doing. But
well, Bert, you're describing a classic case of orthostatic hypotension. That's the doctor's term for stand up, oops, feeling dizzy. And what that means, quite honestly, is that you're going to have to get up from the couch cautiously. So don't ever stand up suddenly and start walking, because you might end up on the floor.
Bert, did we interrupt you before you were finished with your story?
No. I think I got everything out.
Okay. Well, excellent. Be careful. And we do understand that sometimes Flomax is essential to help you not have to get up 3, 4, 5 times in the middle of the night to go to the bathroom. That's when it's especially important to be careful if you do get up to go. So thanks for the call. Let's just give the phone number again, Terry.
Absolutely. 888-472-3366. That's our number. We'd love to talk with you and hear about your experience. And let's talk to Janet in Pittsburgh, North Carolina. Janet, tell us your story, please.
Hey, how are you?
We're doing well.
I am good. I'm prescribed Fatalities, which is also called sertraline, to help me sleep. I have a problem with insomnia. And the prescription is 50 milligram tablets. And it says take 3 to 4 tablets by mouth at bedtime as needed. I cannot. That's an overdose to me.
Yeah.
But not too long ago, I took 2. And right before that, I took 1 5 milligram diazepam. And I fell. And I had fallen last October, a year ago, almost exactly a year ago, in formaldehyde dust left in my house by a contractor. And that was a disaster. I mean, I was in ICU for 10 days, but that didn't involve a drug. That involved me trying to clean up this dust.
Uh-huh.
But now, just the other day, it was September 9th, I think.
Well,
But I was dizzy when I got up.
Well,
I understand, Janet. We actually would like to make some comments on what you've told us, and we'd like to remind everybody that when you want to talk to us on the show, you need to turn off your radio, because otherwise it will be distracting for everyone. So, Janet, I'm gonna hang up here, and we're gonna make some comments about the diphenhydramine and the sertraline that you have been taking.
I thought I also heard her say something about diazepam.
I didn't catch that, but it might have been there.
I thought I heard that.
But-
and that would be, of course, a benzodiazepine.
Sertraline is one of the medications that Dr. Farley was talking about that put older people, and it sounds like Janet might be an older person,
It does sound that way.
put older people at risk for falls. And Joe, we were talking about drugs that are prescribed. Sertraline is a prescribed antidepressant. Obviously, Janet's doctor is prescribing it for her sleep. That's an off-label indication.
I'm having a hard time understanding that. And she said 3 or 4 pills, and
Yeah.
I'm thinking,
Oh, whoa. Yeah, that doesn't
that doesn't compute.
sound like a good idea.
Well, first of all,
But diphenhydramine, Joe, in combination with sertraline, or even by itself, tell me about diphenhydramine.
well, of course, we're talking about Benadryl. We're talking about the PM in Tylenol PM.
And a lot of people who have trouble sleeping will take this medication, which is over the counter. You can take it every day without even telling your doctor, but we like to suggest you need to tell your doctor.
And we'd also like to suggest that if you have to get up in the middle of the night to go to the bathroom, it would not be a good idea to take any of those PM pain medicines, because they could make you woozy, at 3 in the morning when you get up.
And sertraline as a sleeping pill, if you're able to. Bad idea.
Well,
Get
let's-
your doctor to give you some.
About the beers list, and we're
Let's
not
do.
talking about drinking beer.
Right. No, we're not. We're talking about a gentleman whose last name was Beers, who was concerned about this type of problem.
It was spelled Beers, Dr. Beers. And before we do that, Terry, what's the phone number?
The number is 888-472-3366. And Joe, tell me more about Dr. Beers and his list.
Well, he created a list many decades ago, and he said to his colleagues, doctors, don't prescribe drugs on my beers list, because it will make them vulnerable to lots of problems.
So the drugs that Dr. Beers put on his list are drugs that are potentially inappropriate for older people. And sometimes referred to as PIP, potentially inappropriate prescriptions. But basically, we're talking about older people because they're more vulnerable to problems with certain drugs.
Well, what's become very popular these days is a category of drugs called gabapentinoids.
And we've got a comment on that, Joe, from Facebook. Would you like to hear first? And then you can launch into your...
I would like to hear it.
Yeah, okay. Mary Jo wrote, I'm a paramedic. I have a question about Neurontin. People are prescribed this all the time for their peripheral neuropathy, which makes them a fall risk anyway. But when elderly people consume it, they have a bigger risk of falling. And I can't read the rest of Mary Jo's comment, sorry to say. So now you get to carry on about
Mary
Neurontin.
Jo is a
paramedic.
So she is likely to be in that emergency.
She gets called
when
somebody falls.
When the ambulance comes, that's Mary Jo. And the gabapentinoids, and that's gabapentin. It's pregabalin, Lyrica. She mentioned Neurontin, and these drugs are now being prescribed so widely for pain, especially for nerve pain. So gabapentin is the number 5 most prescribed drugs in America today. So many people are in pain and they can't take opioids because doctors are afraid of them or they're afraid of them, and as a result they're put on gabapentin, and it can make you vulnerable to falls.
It can definitely.
Number again, 888-472-3366 if you'd like to join our conversation. Are you taking 1, 2, 3, maybe 4 blood pressure medications simultaneously? How does that affect your level of dizziness? We'd love to hear from you. Again, that number, 888-472-3366.
And we go to Peggy in Auburn. Peggy is, where is Auburn exactly?
It's in the southeast corner of Nebraska.
Wonderful.
Right next to Iowa and Kansas.
Okay.
Now Terry, where did your mom grow up?
In the western corner of Nebraska. We're not going to get into geography. We don't have time for geography, but I appreciate that. Now, your story, please.
I am taking 2 blood pressure medications, and at the time, amlodipine, and my doctor prescribed hydrochlorothiazide, and that made me dizzy, and I passed out. I walked outside. It was sunny. It was warm. Went to the ground.
Oh my!
Fell to the ground.
And
I called him and told him he changed the medication to metoprolol.
Okay.
Metoprolol, right? A beta blocker.
Metoprolol, yes.
And were you able to get up and manage to not break any bones on that fall?
I did not break any bones. I'm 59 years old.
Okay, so you're the people who are most likely to break bones are the really older people, 80 and older. So we're glad you didn't break anything, and we're glad that you realized that the drugs causing your problem were your blood pressure medicines, and you got your doctor to change the prescription. Good work, Peggy. Thanks for calling.
We appreciate it.
And Joe, we're getting close to our break, aren't we?
Oh, we got lots of time.
Okay.
I think it's been so long since we've done a live show, we kind of have forgotten the time cues.
Yes.
Al, we're still good, right?
Yeah,
we still
we're fine.
We still have 2 minutes.
Okay.
So, shall we go to Herb?
Sure.
In Research Triangle Park, North Carolina. We can just squeeze Herb in.
I think we have enough time to talk to Herb.
Herb, what's the story?
Hi, Terry, Joe. Good conversation. I don't know what to say. Here it is. I have a 97-year-old mother who has no issues other than she is not 120/80.
Oh my!
So he has been prescribed amlodipine, Lasorda, those kind of things. I have been fighting this battle for some time. So what I would like to say is that your audience, don't give up the fight. Don't give up the fight. What I did was I said, look, when she goes into to see the doctor, she's excited because she gets the white coat syndrome. So what I do is I have her and me to take her blood pressure in an ambulatory way throughout the week, not just there. So that would be my suggestion to people. At 97, she does use a walker, I will say that. But I think that I think sometimes trying to do good does not always end up being good for a 97-year-old mother. And I thank you so much every week for what you do, and I also do your subscription as well.
Herb, thank you
Thank
so
you.
much for that call, and thank you for watching out for your 97-year-old mother. The fact that she uses a walker is very smart, and the fact that you are taking her blood pressure, making a record of it, so that you can show the doctor what her blood pressure is like at home. That makes a lot of sense.
Well, this idea of white coat hypertension is something that I think a lot of people have to struggle with because, they have to drive to get to the doctor's office. If there's traffic, it can be very anxiety producing. And then the question becomes one of how well is your blood pressure taken at the doctor's office? When we come back after the break, we're going to ask you to give us a call about how your blood pressure has been taken. So there are some guidelines from the American Heart Association. You're supposed to, number one, be allowed to rest quietly for about 5 or 10 minutes when you get to the doctor's office. You're encouraged to go to the bathroom and pee. And then when you get into the office, they need to make sure that they take it correctly, that you're not sitting on the exam table with your arm dangling down, that you're in a chair with your arm supported. Has that happened to you? I'm curious. Have you been encouraged to follow those guidelines, or did they just take your blood pressure as soon as you walk in the door? Give us a call. Tell us about your experience with white coat hypertension. Our lines are open at 888-472-3366. You can send us something through Facebook.
That's right. Facebook, we're at People's Pharmacy, and that's how we got Mary Jo's comment.
White coat syndrome is very important, so please follow the next segment of how to take your blood pressure the right way.
888-472-3366 is the number to call.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared, drug-free treatment for nasal congestion and runny nose, a sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Have you ever been warned about drug-induced falls? Has your doctor evaluated you for such a risk? And how would they even do that?
I'm not sure how they would do that, but there are some tests that they use to see how people can get up out of a chair and that sort of thing. So there may be some assessments.
Well, physical therapists do this all the time.
That's true. They check your balance.
And doctors should be trained so that they do know how to test not just an older person, anybody, especially if they're taking more than one or two medications. And I suspect that if you were to ask a lot of nurses these days, when a patient comes in, how many drugs are they taking? I bet the average is more than 2.
Especially if someone is struggling with high blood pressure. Now, I love the idea that Herb suggested a few minutes ago, that you should take your blood pressure home and keep a record of it so you know what it's like throughout the day and you can share that with your doctor. That's important.
And does a 97-year-old woman need a whole bunch of medications to get her blood pressure under 120/80?
The idea is that you're going to increase longevity, but once you get to 97, I don't know that you're aiming for greatly increased longevity. She's already there.
The risk of a fall
Is significant
and worrisome.
Yeah.
I remember my mom went in to see Dr. Bob Gutman, who was an internist, and he said, Helen, I could get your blood pressure down to 120/80, but you'll feel bad. And are you willing to take the risk for a stroke and let it be a little higher? And she said, yes, Dr. Gutman, I'm willing. And she lived to 92 and died from a medical mistake.
But she chose not to have a fall because the idea of a fall frightened her.
It sure did. You have a story from Jane.
I do have a story from Jane, and then we'll go to the calls. Jane said, I worry about how often doctors put people on blood pressure drugs based on one reading at the clinic. Way too often that reading was gotten by totally incorrect methodology. Like many people, I have white coat hypertension. And Joe, when we're done with Jane, we'll ask you to explain that. I now take a chart of at-home readings covering the last 10 days to 2 weeks of several readings a day. Even though these are perfectly fine numbers, I still have to fend off the doctor wanting to start me on meds based on the somewhat high reading at the office. Also, in the last 20 years, my pressure has been taken correctly only 2 or 3 times. I wonder how many people are dutifully taking their medication every day based on a single reading done improperly at the doctor's office, and therefore are perpetually experiencing low blood pressure or maybe dizziness at home. I suspect a fair number of falls, appearances of cognitive decline, etc., are the result of this unfortunate dogma. So we appreciate Jane's comments.
We surely do. And this idea of white coat hypertension has been controversial for decades. There are some people who say, oh, that's all nonsense. Over 90 in the doctor's office, they, even if their blood pressure is 120/80 at home, that
Thank you. Hi. Yes, first time caller. My husband is 86 and he takes many drugs for a variety of issues. But one of the drugs that he's been prescribed over the years is Viagra.
Mm-hmm.